If a young child gets an ear infection, the drug of choice to treat ear infection, providing there's no allergy, any medication, would be which drug would you select?
The first-line medication for new ear infection is still amoxicillin. However, most people recommend, including the American Academy of Pediatrics and Otolaryngology, using high-dose amoxicillin.
That's 90 milligrams approximately?
That's 80 to 90 milligrams per day.
So one would get a dose like 400 milligrams twice a day?
Twice daily, yes, 400 milligrams twice
and so
daily.
Any pharmacist listening now, that is the recommended dosage, is that correct?
That is the recommended dosage. However, there are certain situations that make a child less likely to be treated properly with amoxicillin, meaning they're more likely to have an infection resistant to amoxicillin. And the three common factors are a child under the age of 2, a child in daycare, and a child who has recently been on antibiotics, recently being usually within the last 2 or 3 months.
And what would be the recommendation going from amoxicillin or Augmentin to what's next?
In that case, if amoxicillin has already been used, then the next step is to either use a cephalosporin, a mid-level cephalosporin, Omnicef, Cefzil, those are, or the generic names of those are Cefdinir and Cefprozil are commonly used. Augmentin is an excellent backup antibiotic. It's probably the most effective, and in fact, all antibiotics are really compared to Augmentin. And Augmentin also now has a high-dose component called, or high-dose variant called Augmentin ES600, and the dose for that would be a teaspoon of that per 30 pounds child weight twice daily.